If you want to get rid of wrinkles under the eyes, do not make this one mistake. This sock is going to teach you about why surgery under the eyelids causes some of the worst complications that I see in my practice. If you think that cutting out this bunched up area is going to make this sock fit better, then you're making the exact same mistake that surgeons make when they try to cut out skin under the eyelids to fix wrinkles under the eyes. The skin pinch eyelid surgery is advertised as like a quick fix that's going to fix that crepey, wrinkly skin under your eyes. But this popular procedure, when performed in isolation, can have a big risk to it that can change the shape of your eye, and a lot of surgeons are not necessarily telling you that before you have the procedure. Before you consider having skin removed from under your eyes, you have to know the one question that you have to ask your surgeon to prevent this problem from happening. My goal here is not to scare you. It's to give you the information you need to make an educated decision about what procedure is right for you to help you with a common problem, those wrinkles under the eyes. So let's start with that problem, that thin, wrinkled skin under the eyes. It could be from sun damage, genetics, or just time catching up to you. A lot of my patients come in, they look in the mirror, and they're holding it up in front of them, and they're like, if you could just get rid of that thing that I'm pulling. And I understand that's tempting to think that just cutting that out is gonna fix all the wrinkles under your eyes. But that is a big misconception. That's the promise of the skin pinch, or what's technically called a pinch lower blepharoplasty. On the surface, it sounds like nice, minimally invasive solution. Maybe you're on the younger end and you don't want to get, fat or muscle messed with under the eyes. You just want to have a little bit of skin removed. Totally makes sense on its surface. And the technique is exactly how it sounds. A surgeon pinches the skin under the eye, snips it away after numbing it up, and then puts stitches in. That's really it. It's often done in the office, maybe even under local anesthesia, and it's overall pretty quick recovery. It's marketed like it's some sort of targeted strike against aging so that you don't mess with anything deeper like fat or muscle or anything else. But I can tell you that it causes real problems when it's done by itself. And if you keep watching, you'll understand why. It sounds so easy, but for the vast majority of people who are looking for a solution for aging under the eyes, this is exactly what you should not do. Let's go back to our sock example. If I were to tell you that in order to fix the bunching of your sock around your ankle, you should just cut out the fabric at the bunching part and cut out the wrinkly parts, you would look at me like I'm crazy. Because obviously, it's the tightness and the elasticity of this part of the sock that makes a difference in terms of how the sock fits and whether it bunches around your ankles. The same mistake is made with eyelid surgery. Somehow people have it in their heads that if you just take a little bit of skin, it doesn't matter what's going on with the tendons and the support structures above it, it'll somehow just fix the wrinkles. And yet what it will actually do is it'll pull the eyelid down, just like if you tried to put the sock back on, it would be foreshortened and you wouldn't be able to lift it back up. So even though it's tempting to think that if you just cut out some skin, it's gonna smooth out these wrinkles again, it's the same thing as with the sock. If all you do in isolation is just cut out the skin, you're ignoring the elastic support structures that sit above it that are contributing to how the eyelid sits. And you're gonna set yourself up for one of the worst complications that I see in my practice. I'm gonna tell you a little bit more about this problem if you keep watching. So what is this significant risk? It's something called lower eyelid retraction, or pulling down of the eyelid so that you can see the white part there, and it just kind of looks a little bit ghoulish or like a zombie. It doesn't look right, it changes the shape of your eye, and it's something that I unfortunately see in my practice in a lot of young patients who don't have a lot of wrinkles to begin with, and that makes this problem 10 times worse. This is not just a cosmetic issue. When your lower eyelid is pulled down, it's more exposed to the elements, your eyes will be very dry. In some cases, your eye won't even close when you sleep, and that means that your cornea, the front part of your eye, can get irritated and scratched and even develop an infection sometimes. This is not just a cosmetic thing, but it can be very emotionally challenging to look at yourself in the mirror and to see that white below the eyes when you were trying to have a procedure to make things look better in the first place. Now, to understand why this happens, think of your lower eyelid like a hammock. The hammock is held up on both ends by an anchor, one on the inner corner of the eyelid, one on the outer corner of the eyelid. The middle part of that hammock or the seat is a combination of two structures. There's a collagen plate in your eyelid called the tarsal plate. That's like the keystone foundation piece. And then there's muscle before you get to the skin. And those two things are very important to normal blinking and normal shape of the eye. If those structures are intact, the eyelid will be tight against the eyeball and it won't be pulled down and away from the eyeball. That's the critical difference. Now imagine that you've got a blanket hanging over one side of the hammock, and that's going to be our skin. Well, if the blanket is touching the ground, would it make sense to just cut the bottom of the blanket off? Or would it make sense to actually fix the hammock and tighten the ropes that are holding things up? Just think about that, because cutting the skin is the exact same thing as just cutting off half the blanket so it won't touch the ground. In fact, if you were to cut the blanket in our analogy, it's just going to pull the hammock down, and it's going to make it harder for things to bounce back up if those ropes that you have at either end are a little bit loose or lax, which can happen as we get older. So this is exactly what happens with lower eyelid retraction. The surgeon is essentially ignoring the ropes that are holding up the hammock, inner corner and outer corner, and is just focusing on the middle part, pulling it down and hoping that everything will stay tight enough so that it won't look like you've had a problem or a botched plastic surgery afterwards. If the tendon, especially the outer tendon, that's called the lateral canthal tendon, has any laxity or any weakness to it, whether that's just from aging or rubbing your eyes a lot, that can loosen that tendon. Then if you take out skin by pulling this out, that laxity is just going to stretch, and then your eyelid is going to be pulled down like this. Does that make sense? So this brings us to one of the big myths with under eye surgery, that the skin is somehow the problem. In my experience, it's almost never about skin quantity. Sometimes it's about skin quality, but often has to do with how those support structures are anchored and how the fat and the muscle are related that cause some of these wrinkles under the eyes. And quite frankly, all of us have some wrinkles under the eyes when we smile. It's just a natural feature of our youth. And that's not a bad thing. But sometimes chasing after every single wrinkle is going to lead you down a path where you're going to experience a very bad complication with your eyelids. So your surgeon needs to be thinking about all the structures around the eyelid that support the skin before they consider removing any of the skin. An expert in eyelid surgery is going to understand that there are a lot of layers to this structure and a lot of levers that you have to push and pull against if you're going to manipulate the skin at all. So if you go to a surgeon who's just like, yeah, let's just do a skin pinch. We'll take out some of that extra skin. It's going to take away the wrinkles under your eyes. And if they don't do an exam where they're actually checking the laxity of your eyelid, checking that tendon, then they're kind of offering you a solution without really diagnosing the problem in the first place. Modern eyelid surgery focuses both on the wrinkles, but also on maintaining your eye shape so it doesn't make you look like you've had plastic surgery. So if a skin pinch on its own is a bad idea, then what can you do to prevent this problem of eyelid retraction from happening? Let me tell you the one thing that you need to ask your surgeon if you are considering a skin pinch procedure. Specifically, you need to ask your surgeon, if you're gonna remove some of the skin under my eyes, what are you gonna do to support the structures around it so that I don't get sagging or drooping of the lower eyelid or lower eyelid retraction. The gold standard for preventing this complication is to do something called a canthopexy or a canthoplasty at the same time as removing skin to support that support structure while you're also pulling some of the skin out. A canthopexy is a surgical step that secures that outer corner of our eyelid hammock, the lateral canthal tendon, onto the lining of the bone, or sometimes I even anchor it into the bone in order to provide maximal support, keep that tight shape at the corner of the eyelid if you are going to be removing any skin under the eyes or doing any procedure to address wrinkles under the eyes. It's like pulling the rope of the hammock tighter so that the hammock stays farther up above the ground, keeps that tautness so that when you sit on it, you're not sitting on the ground. By performing a canthopexy, the surgeon makes sure that when they remove that little bit of skin, it's not going to be strong enough to pull the laxity down of the eyelid and cause lower eyelid retraction. Think about it this way. A skin pinch is subtraction, a canthopexy is reinforcement. For most patients, the safest and most effective way to address lower eyelid wrinkles involves some combination of both. If you're going to be removing skin, you have to account for the fact that's going to pull on those support structures and address that at the same time. So this is the most critical part. How do you use this information to protect yourself? The goal here is not to make you afraid of surgery. It's to arm you with the information you need so that you can get this surgery done safely by an experienced surgeon. When you go for a consultation, your first job is to vet the surgeon. You're looking for a board-certified surgeon specializing in something like what I do, oculofacial plastic surgery, or facial plastic surgery, or comprehensive plastic surgery, but especially someone that does a lot of eyelid surgery, and they should be able to show you before and after photographs of how they address wrinkles and sagging under the eyes. And when you look at those photographs, look carefully. In the after photos, if the surgeon's showing more white below the eyes, that can be a sign that maybe acanthopexy was not done, or they're not properly accounting for how much taking out that skin is going to pull down the lower eyelid. When you look at these photos, does the eye maintain that tight almond shape? Does it look natural and refreshed, or does it look done and altered? Those are kind of your key questions that you should be judging when you look at before and after photos. Then during the consultation, observe how the surgeon does the exam. Are they just looking at the skin, or are they also pulling down to check for laxity? Are they tightening and pulling at the corner to see if that would improve the eyelid shape? Those are the key things you want to look out for. And if the surgeon doesn't do any of those things, that might be a red flag. Then it's your turn to ask the critical questions. Question number 1, based on your exam, do I have laxity of my lower eyelids? Because that's what's going to determine how likely you are to get lower eyelid retraction. Having said that, if you're a younger patient, I would strongly encourage you to be careful about taking too much skin under the eyes, because even if you don't have that much laxity, an aggressive surgeon who takes out too much skin is still going to overwhelm the hammock, and then you're going to be left with a lifelong problem. Question number 2, what is your specific plan to prevent something called lower eyelid retraction in my case? This is a direct question, and it demands a direct answer about the biggest risk of skin pinch surgery. And then question number 3, the million-dollar question, are you going to be performing acanthopexy or another procedure during the skin pinch to prevent that problem afterwards of my lower eyelid sagging down over time? If a surgeon dismisses your concerns or tells you acanthopexy is never needed or has just a one-size-fits-all approach to their surgery, that might be a red flag. The right surgeon is going to welcome these questions. If patients ask me questions and have done their research, it makes my consultation so much easier because then I can just go through what I need to, knowing that we're kind of on the same page about surgery. If you're finding this information valuable, please hit the like or subscribe button to support the channel so that I can help more people like you who are just looking for safe solutions to common eyelid problems. I'll keep giving honest, straightforward breakdowns of common eyelid procedures on this channel. Your most important next step is to schedule a consultation with a qualified, board-certified surgeon who does lots and lots of eyelid procedures. Do your homework, ask these tough questions, and don't move forward with a skin pinch surgery unless you're very confident in the surgeon's plan. The idea of a quick skin pinch is tempting, and I understand it. But the reality is the lower eyelid is an exquisitely complex and delicate structure, and I see problems from other surgeries that happen to people on an everyday basis. So if you're looking for the difference between having a refreshed and natural look or having a permanent lifelong issue where the eyelid is pulled down, think about one thing: respect the hammock. Don't get a skin pinch surgery unless your surgeon has a clear and definitive plan to prevent lower eyelid retraction. You are your own best advocate, and if you are armed with these questions and this information, you're going to get a great result for years to come. Thanks for watching, and I hope this has been helpful.